The threat is low here, but we know what a deep crisis it is for people in West Africa. So to help contain this unprecedented outbreak, Ontario will support the emergency response in West Africa. Our government is providing $3 million to help those on the front lines of the Ebola outbreak treat patients and contain the spread. We will provide $1 million to Médecins Sans Frontières to help them to treat patients and train staff, and another $2 million to the Red Cross to support efforts to raise awareness, identify cases, and to prevent the spread of the virus. I want to encourage people across Ontario to match our government's donation. The people of Ontario are compassionate and caring and generous, and now is the time to work together and to lift up the incredibly courageous efforts that are already in place to save lives.
What we're doing here in Ontario is about preparedness, but Ontario also needs to be part of the response in West Africa. And I know that one of the most challenging things is not having sufficient resources on the ground to be able to do the work that you're so skilled to do. And that's what Ontario is responding to this morning with this $3 million investment to MSF and the Red Cross. There's an infrastructure in West Africa that unfortunately doesn't come close to comparing to what we have here. Just as one indicator, in Canada, we have one physician for every 400 citizens. In Liberia, they have one physician for every 74,000 citizens. The changes that we made and the directive that was distributed to hospitals, well, Rona Ambrose, the federal health minister, called it the benchmark for Canada. Our nurses as well on Friday indicated that they were more than satisfied with the processes, the protocols and equipment that we had put in place. But again, it's, as I'm sure our colleagues from MSF and Red Cross can attest to, the situation is no different in West Africa in this context, is that we need to constantly be learning and finding ways, it's called the precautionary principle in public health, to find as we progress this epidemic in West Africa, as it continues and we continue to be prepared in Ontario, we need to constantly be looking for ways that we can improve the measures that are in place.